As we sit here, claims have been paid up to September 2020. Correct me if I'm wrong, but if you take into consideration the statutory 3-month lead time of reimbursement, you have 2 months arrears. Do you foresee sustainable?
Honorable Chair, the answer is yes and no. Sustainable to the extent that we continue to get releases from the Ministry of Finance as has been given to us in the last 4 years. If that happens, then I would say we'll always have resources to be able to meet our reimbursable expenditures from the facilities. If that doesn't happen, it is likely we may go back to the same old problem of accumulating arrears that will hamper the efficient performance of the health insurance system. That is why I'm saying it is either yes or no. But for health insurance, I must be honest to tell colleagues and the whole country that costs for healthcare continue to escalate. But premiums that we pay to health insurance has been stagnant for a very, very long time, since the time we started. And if you look at actuarial studies, financially, these schemes that we are running, if we don't find a way to bring in some extra resources, either through increments in premiums or through more government resource allocation to support the schemes, going forward, we might not continue to see a sufficient performance as it is. So that is why I can say about this sustainability. But I foresee that it's a very good program that should continue to run in this country. And therefore, all of us parliamentarians will have to put whatever efforts we have to make to enable the executive or government to continue to support the schemes. Thank you, Honorable Chair.
Honorable Minister, you talk about premiums, but I know that health insurance has 2 components: the premiums paid directly, and then the SNIT contributions, as well as what is paid on services. So which one do you expect that we should increase to be able to make the scheme sustainable?
I would say both the levy and premiums that are paid by individuals.
What about the SNIT part? Is that sufficient?
The SNIT part invariably is a small component of the entire health insurance resource. And since SNIT is part of people's pensions, I dare to say, if I become part of those who make that decision, I will fight and advocate that we don't touch the SNIT component at all.
Chairman, since the nominees and economists increase the levy by what margin? And does the releases from the Ministry of Finance to the NHI include bonds, to your knowledge, bonds?
Thank you, Honorable Chair. It includes bonds because there were debts without money sitting in finance to pay. The areas that was left for us to inherit, Honorable Chair, we didn't have money that was supposed to come from finance. So the Minister of Finance couldn't use current levies to pay for debts. That levies are collected and probably reallocated somewhere else. That is why the Minister will have gone for bonds. It was part of our suggestion because we needed money to ensure that health insurance continues running.
You know how much bonds have been issued to the National Health Insurance Authority?
Faint memory, I'm not very, very sure. We close to about 400 million Ghana cedi. I said I'm not very, very sure. I can actually cross-check and give you the exact amount.
Honourable members, let's get the rules clear. I called for the notes to be clear. 3 questions clear. If there's a need for follow-up, it should be from the answers. That's why I'm stopping the Chief Whip from asking another question. Yes, Honourable Samson.
Thank you very much, Mr. Chairman. Mr. Chairman, in one of the broadcasts to the nation by the President with regards to COVID-19, he said the President promised that his government was going to construct 88 district hospitals. And then on the July, when the president met the chiefs and elders from Bolgatanga and Bongo and Talensi, the president was specific that those 88 hospitals was going to commence in July 2020. We are in February 2021. Can you tell this committee how many of those 88 hospitals have been built so far? And where, if you can mention those districts to us.
Thank you, Honorable Chair. That was the President's vision, which was supposed to have been translated into action. Seriously, the President set machinery in motion. He set up a committee in the presidency, chaired by the Chief of Staff. I was a member. We pulled 1 or 2 infrastructure directors from my ministry, Ghana Health Service. There's also a fair representation on that. What they asked us to do immediately was to write to district directors for health services. And the local government minister was to write to all these assemblies for them to allocate land and give us the site plans of where they wanted these districts' hospitals to be sited. As I speak, we still have close to about 13 districts that have not completed that exercise. Some of the districts, after they got the initial responses, there was a team that was set up. A coordinator has actually been appointed to coordinate this because the work volume is so huge, said that added on to our ministry's work in the midst of COVID would have meant that we wouldn't move at all. So they sent teams into various zones of the country that have been divided by the coordinator and the team that is working on these 88 hospitals. Some of them have litigation matters, and so we have to find a way to settle them. We are still working on these, and contracts have been awarded, and we are waiting to do proper sword cutting for all these things, actual construction to start. The preliminary works have actually been done. We are not waiting for the ones that have been submitted and finished with land issues, but we've started working on them. We face challenges in the midst of COVID. Things were not moving the way things should have gone. And that is why you will see we might not have started serious work on any of them. But our target was to have at least reached length level by close of the year. Unfortunately, we couldn't get there, but we are working seriously on this matter.
Mr. Chairman, this is a follow-up. Nominee said that what the President said was his vision. But I've said to you that in July, the President was specific that the project was going to commence in July. So how can commencement now becomes a vision?
Honorable Chair, what I said was that President vision that should have been translated into action. And that translation gave us a roadmap. And that is how come the President said we'll start in July.
Mr. Chairman, thank you very much. Can you tell this committee how much it will cost to construct one district hospital and the total cost for the 88 districts?
Mr. Chair, the initial costing was done on the basis of averages. And we're looking at between $5 million to $7 million per hospital. On the issue of equipment and other logistics came in, other equipment came in, we were still thinking that a maximum $7 million could do what we should do. If you multiply this by 88, and the 88 has even changed to 111. We're adding on regional hospitals for regions that do not have regional hospitals, especially the 6 new ones, plus the Western region, the Northwest, Southwest region. And then we are also rehabilitating Ifiankwanta Hospital. This, together with other places that we left out when we're counting these other hospitals, 88, have brought this number to a total of 111 at the moment. That is what we are working on. If you look at the minimum 5 million and the maximum 7 million multiplied by the numbers that I've mentioned, take away the regional hospitals because they may come at a different cost. This is what it is. When the team went round, topography of land and all that is indicating that prices might not be uniform across the country. In some places, there may be some escalations. In some places, it might be probably lower. So we are still computing, and unfortunately at this stage, if I can tell you exactly how much the total will be, it will just be an estimate of what I've said. 5 times 111 minimum, 7 times 111 minimum. That is what I can say, Honorable Chair, for the question.
Chairman, just a follow-up. So if I did a little arithmetic, 7 times 101, do you have that on budget? Is it budgeted for? Or will it be budgeted for?
Mr. Chair, definitely without a budget, we cannot utilize the money. And this question, I think finance will be able to actually put in. To the best of my knowledge, there is a provision, and finance has assured health that they are sourcing and have achieved some portion of sources that will do the work. So I wouldn't be the most appropriate person to answer this budgetary question, Honorable Chair.
Yes, Honorable Secretary.
Thank you, Mr. Chairman. Mr. Chairman, now that the COVID situation is becoming alarming and the numbers, affecting numbers is increasing, the minister is aware that there are some regions that do not have ICU facilities as we speak. What are you doing to ensure that those regions, when they need that services, they will be able to get it? Because I know that Western North, for instance, don't have ICU, OT region don't have, have already don't have, but they are supposed to benefit or enjoy such facilities. In the absence of ICU, what are the immediate steps you are taking to ensure that those people are catered for?
Honorable Chair, at the onset of COVID onslaught in the country around March last year, the first instructions went from Ghana Health Service and the Ministry to all these hospitals to create spaces to fight the COVID battle. Honestly, these hospitals have never had intensive care units to the level that can take care of COVID, severe and critical COVID patients. So we kept on referring to the regional and, how do I call it, the teaching hospitals. In the midst of that, after having evaluated the inadequate infrastructure in our facilities, we earmarked about 12 places where we set out ourselves to actually begin to construct treatment centers very quickly for us to be able to put in things to do the type of work my honorable colleague is asking about. Places like Zebila, Goso, Sefioso, I think somewhere in Soyo also. The Dudua one is fully completed. Several places that we earmarked. Fortunately, the monies that were supposed to have utilized through the World Bank thing almost all went into procurement of PPEs, sanitizers, and face masks, and gumboots, and caps, and gowns for the doctors, and all that. So the project halted a little bit. It is only now that the second tranche of the World Bank support is giving us room to actually advance monies we ask the contractors to pre-finance and we will come on. And I believe by close of this year, all these treatment centers will have been completed. But we continue to rely on our referral systems to try to see how best we can solve the problem. Luckily for us, the enhancement of the ambulance service with 307 ambulances, one for each district, seem to be supporting us a little bit, and we keep on getting patients referred in ambulances coming close to where we have these facilities. That is what I can say in respect of this question, Honorable Chair.
Thank you very much, Honorable Samsehi. Yes. Is that Honorable Member for Juso? Okay.
Thank you very much, Honorable Minister nominee, and congratulations. I wish to thank you for your efforts in the handling of the COVID-19 pandemic. At a point, you had to sacrifice by being infected with the disease in line of duty. And of course, it's a sacrifice. And you are doing all this for the country. I want to find out how prepared are we as a nation for if another pandemic is to strike. What do you suggest that we should be doing now in readiness to prevent a future pandemic in terms of our readiness in handling of such matters?
Thank you very much, Honorable colleague. Honorable Chair, we were just about finishing the zero draft of emergency response strategy that will have eventually dovetailed into establishing a proper CDC in this country when COVID strikes us. So all those experts who were working on this strategy, including myself, had to put that one in the back burner to begin fighting the COVID pandemic. When the pandemic started slowing down and we thought that things were stabilizing for us, we were revisiting it, and then all of a sudden the upsurge that we have now. But that is a very big priority on the agenda if, Honorable Chair, you and your colleagues give me the nod, something that we're going to tackle seriously to get a fully established CDC in country before the end of the year, when I get my note. The draft strategy is ready, and all I'll have to do is to do some more stakeholder engagement. I'll bring it even here to the committee for engagement, and we will look at it, pass through cabinet, and to come here for us to actually see it before it goes through. But I'm very committed that we will see a CDC established in the country before the end of the year. Thank you.
Mr. Chairman, one key problem in our country hospitals is the lack of beds, the no-bed syndromes. And I know that as Minister of Health, you have made a lot of efforts to address this problem. But unfortunately, this problem still exists in many hospitals across the country. If you are given the nod, what will you do to make sure that this problem is resolved?
Honorable Chair, we continue to invest into equipment into our facilities. Not very long ago, we were given some resources to have procured 10,000 hospital beds that we have distributed equitably across the country. Again, we are working on deploying e-health electronic systems that has a component that does bed management in the facilities. So that in the very large facilities, you might see some beds empty in one department, and then emergency will be full. So we can see through quickly, and reports from the system will give you an indication of how to resolve that matter. But in the meantime, we've given instructions. There are no facilities to turn anybody away on the basis of no bed syndrome. We should find a way to keep the patient, to stabilize the patient, before we begin to look at where we can conveniently transfer that patient to rest. So that is what we are doing. I believe that going forward, we'll continue to find resources to put in investments to help us resolve this matter.
Finally, Mr. Speaker, one of your key achievements as Minister of Health that you've been commended for is the introduction of innovation, drones, into our hospital services. I want to know from you how the deployment of this drone is impacting on our health systems.
Honorable Chair, one significant thing I may want to mention is the recent floods in northeastern region after the Bagri Dam was opened, as even some parts of upper east region. Because of the drones that we have installed, several places you couldn't reach. So we were flying essential medicines with the drones to these areas. Prior to that, you will have seen people carrying drugs and their vaccination fridges on motorbikes in water, crossing these rivers to reach outlanders. But some parts of the country are now covered. We have installed 4 centers that is helping us do the work that we should do to reach people who are in very hard areas. Now, during the around October, I have been touring the country and looking at facilities and trying to motivate our health workers with my presence. There was a day we went to do a sword cutting for a chip compound to be done at Drobonso, the health center. Whilst there was a problem in there, and then they have ordered the drone to bring some oxytocin to try to support hemorrhaging in a woman in labor. And the drone came at a function where we had a function, dropped the thing, and the cheers that were coming from people there gave an indication that the deployment of these drones have been very useful to this country. And as I speak, they are helping us with the immunization program, flying vaccines to areas where we can't easily reach. And I believe when we begin to do our COVID vaccination campaign, these drones will also be useful to fly some of these things. And their capacity, they even have cold chain storage capacity that will enhance our existing capacity to be able to store our vaccines in there. Thank you.
Just a little follow-up to Honorable Ejisu. Minister Designate, in your answer to his earlier question, you indicated your directive that no patient be turned away for lack of bed. You know that the doctors and nurses can carry patients even if there are no beds, and therefore it creates an obligation. Has it been brought to your attention that some COVID patients have no access to beds, and then there's critical shortage of oxygen for COVID patients in the country? And what are you doing about that?
Thank you very much. But I would say, in a pandemic of this nature, you will expect that the facilities we have would definitely not be adequate. Even in very developed systems like America and the US and Germany, this type of situation you are describing is found even there as I speak. We try to improve on the situation. Last 3 weeks or so, the new infectious disease center that we got support from the private sector fund to do for us, we linked the oxygen in the Ga East place to that. But when numbers began to rise up, we realized that that capacity couldn't do the 100 bed here and 130 bed here. So quickly we had to do emergency thing. And we have installed a new oxygen plant even in that area to work on it. As I speak, our engagement with USAID is bringing in a number of these oxygen plants to be sited. Yesterday, the memo I read through after engagement indicates where we have actually located some of them. We are saying that they should relocate them. WHO is giving us oxygen cylinders as we also strive to procure some more. And we are working very hard to try to see how best we can solve this problem. Now, the pandemic will give us some experience. And if we don't learn from this, and we continue to live our system the way the pandemic came to meet it, then it will not be a problem of only the health minister and only the current president, but posterity and all of us in the country. Thank you, Honorable Chair.
Yes, Honorable Okudze-Tabla.
Most grateful, Mr. Chairman. Mr. Chairman, I would want to begin by making a few preliminary observations. The nominee will have to help the committee with the accurate rendition of his name, because the communication from His Excellency the President, number 14, Minister for Health, Kweku Agyemang, is spelled with a J, Menu not hyphenated. Your CV has Agyemang without a G and is hyphenated. For our records, which one do we go with? The communication from the President or your CV?
My CV, Honorable Chair.
I hope, Mr. Chairman, that the presidency will reconcile these matters. The CV you have submitted to us this time around, I have cross-checked with what you submitted to us 4 years ago. And you may want to look at the Hansard of 27 January 2017. Quite a number of your dates and numbers do not quite add up. So you may want to reconcile that later. Matters to do with your basic education. 4 years ago, you told us 61 to 65. This year is 1960 to 1963. And all the way down to London School of Accountancies. The years are not matching. And you may want to reconcile that later, Mr. Chairman, if you permit the nominee. And if you also look at the face of your CV and the educational background, I do not think it's possible, F and G, that you were at the University of Ghana and at the London School of Accountancy at the same time, 1975 to 1978. I want to believe that is an error.
An error.
So, Mr. Chairman, I believe the nominee will tidy these matters up so that we can have consistent records.
Can easily be corrected. 1988 to 1980, 85 to 1988, the London School of Accountancy.
And the page 2, you have the item numbered G and H, Deputy Minister, Ministry of Transport and Communication, 2001-2003. Deputy Minister, Ministry of Roads and Transport, 2001 to 2003.
Honorable Chair, I can explain that. The first reshuffle by President Kufuor took me into that situation. I was put in charge of Deputy Minister in charge of Transport. And the first reshuffle hived off transport to join with roads. So I was pushed with my Deputy Minister portfolio to join roads. And that is how come I served in roads and transport.
Yeah, but I'm sure at different dates, isn't it? Because what you have here is 2001 to 2003, same period.
The same period. These two ministries,
yeah,
the same period. No,
so these matters, in relation to the CV you presented to us 4 years ago, kindly have a look and let's clean them up.
Thank you.
I want to start with my substantive questions. I hold in my hands the Auditor General's report for your ministry from 2017 to 2019. This is particularly important because you have quite a strong reputation in this House. You were Vice Chairman of the Public Accounts Committee from 2009 to 2013, and became Chairman of the Public Accounts Committee from 2013 to 2017. And I recall those days, all of us as ministers, anytime we had to appear before you, it was quite a dreaded day. You were a very sharp chairman of the Public Accounts Committee, very intelligent, chartered accountant.
I would say.
And Oh, if you want to interrupt, you can go ahead.
I can't remember if my colleague actually appeared before my committee during those days.
I appeared on a number of occasions with my bosses, my ministers, as you recall. And you executed your mandate to the admiration of many as chair of the Public Accounts Committee. And I recall that when His Excellency the President first nominated you, he told the nation that the reason for the nomination was because of your financial prowess, that he hopes you help streamline the finances at the Ministry of Health. Now I look at your audit reports from 2017 to 2019. I have all three reports here. If you look at the verdict of the Auditor General, for example, at page 107 of the 2018 report, the Auditor General writes, "Our review of the mechanism in place at the Ministry in respect of the accounting for withholding taxes was not satisfactory." Was not satisfactory. The Auditor General report, if you do the tabulation, which I have done, beyond the frustrations the Auditor General has documented here. If you take the 2019 report, for example, at page 86, it says, "Our review of the mechanisms put in place at the Ministry in respect of the accounting for withholding taxes was not satisfactory," unquote. Paragraph 176, page 87, it says, "To minimize the risk of abuse, we urged the Ministry to exercise strong control over the accounting processes to ensure compliance with the provisions of the income tax law." The Auditor General reports that we have lost in 2017 21 million.
Honorable, is that report laid before Parliament yet?
Yes, these have been presented to the House.
To the House.
These are my copies, yes.
Of what has been presented?
Yes.
Very well.
2017, we lost 21,396,685 cedis at the Ministry of Health. 2018, Ghana lost 23,142,246. 2019, we lost 18,489,433.86 cedis. A total of 63,028,364.86 Ghana cedis. A colossal amount, huge amount. As former chairman of the Public Accounts Committee, how do you respond to this, particularly in relation to a recent report I've been reading, published online by the University of Michigan, Capacity of Intensive Care Units in Ghana? I'm sure you've seen that report by Moses Sion Frimpong, Sunka Ruture Units in Ghana. I'm sure you've seen that report by Moses Sion Frimpong, Sunka Ruture, Nanasefa et al. And they say that...
And what is the question? Now you're moving from Auditor General's report to intensive care unit report.
Mr. Chairman, it's important, if I'll be permitted, you'll get the nexus. First. You'll get the nexus, Mr. Chairman.
Can I control the proceedings, please? You asked him a question relating to the Auditor General's report. If you let him answer that, then he can follow up. But now you're lumping the two up, and the rest of us must follow you. Please.
Mr. Chairman, I'll follow your guidance. So, Auditor General's report, over 63 million cedis lost at your ministry. Former PAC chairman.
Mr. Chair, just like my colleague mentioned, I'm also very, very familiar with Auditor General's reports. And if you sit in the ministry as a minister, these type of misdemeanor challenges will only come to you after auditors have come to audit. They will then submit management reports. That is what comes to the minister's office, that this is what is happening under you. Can you do something about it? Now, even our Public Accounts Committee, the accountants are allowed space to try to rectify these anomalies. So they find this anomaly against a ministry or an accountant, you won't have to go and rectify. We do something like implementation of auditors' recommendations. So I want to believe that by now, if Public Accounts Committee had interrogated this report, the withholding taxes that might not have been withheld, or those that might be withheld but have not been paid to the GRA, might all have been now implemented as recommendations that they should get through. So the initial recommendation will look like they have lost it. But if we're waiting for Public Accounts Committee to say now, you realize that the ministry might have done something about it, and all these things might have been recovered or corrected. So for now, I wouldn't say we haven't taken a look at it. Any audit, management report that comes to me, we have an audit committee that interrogates this and try to rectify them. But this initial report that comes will give them space to correct anomalies. I may want to look at outstanding recommendations that have not been implemented. And that is where I will say I might have found myself faulty or I haven't done so well. So we may need to interrogate that other report to see whether they have worked on it or not. Thank you, Mr. Chair.
Mr. Chairman, by way of follow-up, these are audit reports from 2017. Can you be more specific as to what you have done? And I want to relate that to reports emerging that Ghana does not have adequate ICU beds. These 63 million cedis, you can use it to solve that problem. You can use it to buy ventilators. It can help us in our COVID fight. There are several regions in this country, if you look at this report, without a single ICU bed. Upper West region, Western region, Western North, Ahafu region, Bono region, Bono East region, OT region, Savannah region, Northeast region, Upper East region. Not a single ICU bed. And we have all these loopholes in the system. As a minister, what are you doing about it specifically?
Colleague, the question becomes a little bit more complex with linking. But all I want to say is the fact that the withholding tax from Ministry of Health doesn't lie in our hands. It gets into a consolidated account if we pay to GRA. So there is no guarantee that that money will come to do this for us. Even if you have collected it, it may have been allocated to Ministry of Foreign Affairs or Education or somewhere else. The bottom line is that
our interest is, could you have done something more to ensure that the money went into the appropriate account? That's what we're interested in.
Honorable Chair, yes, I have explained. The specific question he asked about these particular ones, to be difficult for me to answer because there are several infractions that we deal with when it comes to audit reports. And for you to pick just one or two items to come up with, I can't offhand remember what has been done about it now. But our audit committee is composed of even people from outside the ministry who admonish the accountants who work on it, not only the minister. And I want to believe that going forward with my presence in that ministry, some of these things will see some improvement, enhancement in them. I can't hold brief for directors and accountants who are working, but when these things come up, what I do as a minister or a supervisor, I do try to correct some of them. When I joined, audit queries from Global Fund and other Gavi and all that has reduced. A lot of them have actually reduced. And I'll continue monitoring and make sure that all recommendations from auditors' reports are seriously recommended in the ministry. Honorable Chair, thank you.
Thank you, Mr. Chairman. Mr. Chairman will be counting on his expertise and experience in that regard. The second issue I want to focus on, Mr. Chairman, is the matter relating to the arrangement you put in place at the airport ahead of the reopening of the airport on the 1st of September, what I call the exorbitant $150 charge per antigen test. Can you tell us how the company known as Frontiers Healthcare Services Limited came to be given that contract to carry out the antigen test, and how you also came by the amount of $150.
Thank you, Honorable Chair. Honorable Chair, it will be very difficult for me to answer this particular question. Why? Because there's a presidential task force that is supporting the ministry to do the COVID battle. This particular arrangement was put in place by the task force that reports to the president. Now, they actually did the procurement for the, how do I call it?
Sorry, Chairman, just Minister, whilst you're London, is the Presidential Task Force a procurement entity under Ghana's procurement laws? We need further details, but we're happy to hear you further. Thank you, Chair.
Please, in the midst of the pandemic, I would say this wasn't an anomaly. We had groups that were doing various things. And for the task force to partner with the private sector person to do what we did, knowing very well that the ministry itself didn't have the capacity to do and install the type of equipment they put there, I think was quite normal as an emergency arrangement to have done that.
Chairman, just to take note that we would be requesting the chairman of the Presidential Task Force to be in attendance to give evidence to this committee as a witness to testify to what the minister is submitting before your committee.
Well, that's your suggestion. We can discuss later. Kindly continue, please.
By way of follow-up, are you aware that the company Frontiers Healthcare Services Limited, by registration number from the certificate of incorporation I have here, CS1140922020, was only incorporated on 21st July 2020, a few weeks to the reopening of the airport, and it had no medical laboratory experience? Are you aware?
I would say I'm not aware.
Are you also aware that
Honorable Okudzeto Ablakwa, you exceeded your limit by about 6 questions.
Not at all, not at all, Mr. Chairman, not at all. Not at all.
Honorable member, you had about 5 minutes to talk about CVs. I ignored that. Then you have asked 3 questions. Now you've done follow-up. So you've way exceeded your limit.
Mr. Chairman, I conclude on Frontiers. The Fees and Charges Act, you're a senior member of this House, requires that the $150 should have been brought to this House for approval. It wasn't brought to this House. The Health Institutions and Facilities Act 2011, Act 829, requires, under the first schedule, section 11.2, that clinical and biomedical laboratories must be licensed before they operate. When they started operating on the 1st of September, I have obtained the certificate from the Health Institutions, Health Facilities Regulatory Agency, known as HEFRA. They only licensed them on the 3rd of November 2020. So by the time they were operating at the airport, human lives were at stake. They had not been licensed. Minister of Health, are you aware of these clear infractions of our laws?
Honorable Chair, in the pandemic, we had a phrase we were using, that we were not in normal times. There were certain things that we had to do and try to rectify as we go forward because of the urgency of what we should do immediately. This licensing was done even on my insistence when I went around to do the checks and find out that this hasn't been done, and I said, no, quickly, let us go and rectify the anomaly before things get worse. So when people are dying and people are flying and people want to visit wives and husbands and they can't go, and we needed to open the airports, And we have to put in place something immediately for them to be able to be screened, to try to stop importation of the virus into our country. Honorable Chair, I must admit that some things might have done.
Couldn't Noguchi have done that?
You know, no normal instance. And that is why we have this. Honorable Chair.
Thank you. Yes.
He's asking another question. Couldn't Noguchi have done that?
Honorable, I didn't admit that question. Yes. Now I'll move to the. Yes.
No comment.
Yes. Patrick Bama raised his hand. Yes.
Thank you very much, Chairman. Congratulations, Honorable Minister Designate. Honorable Minister, I have in my hands the Public Health Act, and Part 2 deals with vaccination. Recently, the President announced to the country the strategies he has in place to help Ghanaians get vaccinated with this COVID-19 pandemic that we are facing as a country. And Part 2 of the Public Health Act mandates, Honorable Minister, mandates you to appoint other registered medical or veterinary officers and other persons certified by a senior medical officer with the necessary competence, skill, and knowledge to be able to assist a public vaccinator. You have public vaccinations, compulsory vaccinations, vaccination of adults, and what have you. What strategies have you put in place should we procure these vaccines to get Ghanaians prepared and other certified vaccinators in place to be able to go around and administer the vaccines professionally as stipulated under the Public Health Act? Thank you.
Thank you, Honorable Chair. Honorable Chair, I must mention that one thing Ghanaians should be proud of is the fact that we have a very robust expanded immunization program that sits within the Ghana Health Service. It has a structure that reaches everywhere in this country. As I speak, our traditional vaccinations in terms of polios, DPTs, and all that, by WHO assessment, we are doing 95% coverage in our country. So when we started developing the vaccine strategy for COVID vaccinations, we thought it wisely not to reinvent any wheel, but continue to rely on what is good for us. So if you look at the strategy when it's fully completed and confirmed, you will see that we're using Ghana Health Service infrastructure to actually do the vaccinations when COVID comes. We've started training those who are doing vaccinations, especially for even COVID, so that immediately we get how do I call it, the stocks. We can move in quickly to do our vaccination.
Chair, as a follow-up to that question, I understand that some of these vaccines ought to be stored under certain conditions. Do we have those storage facilities in place, or measures are being put in place to get them? Thank you.
I'm afraid we don't have such ultra-negative cold chain equipment, but we have cold chain equipment that can take some types of the vaccines that we are looking for. The indications we are getting, the first vaccines that we may get to be AstraZeneca, that can be stored in our current or existing cold chain infrastructure to do the work I want to do. One other one that is coming up, Johnson & Johnson, if you're able to even get stocks from that end, that can be stored under normal room temperature, so we might not have so much challenges. We do have limited capacity for those ultra negative cold chain facilities, some limited facility. If you should get some quantities, we can store them in Accra and Kumasi, for example, and use. we don't carry them across the country where we don't have any place of such nature. Thank you.
Chairman, my second question is on our party's manifesto, page 157. The New Patriotic Party, the ruling party, 156 to 157, lists about 13 focal points that government wants to achieve under the second term of the president. And it includes, but not limited to, focusing on telemedicine to enhance health delivery. Can you address us on how you intend to pursue this vision of the president and the party and government? Thank you.
Thank you very much. Honorable Chair, we started working on telemedicine. We have a small committee in Ghana Health Service that is engaging to look at infrastructure and training and what have you to actually get infrastructure to do telemedicine. So there is a program in place to enable us achieve this manifesto pledge, and I believe going forward we'll enhance our activities in there and speed it up and make sure that we're able to position ourselves to do.
Thank you. Last question is on the same Public Health Act, on advertisement. And I'll tie it in with traditional medicine. We've seen that the FDA has taken steps and has been clamping down on manufacturers of non-certified or licensed products. Some included COA FS and others. What are some of the challenges that you think these traditional health manufacturers of these products are facing, and that you, when approved, could be of help to assist them in this regard? Because I believe it's a big industry that the ministry ought to look at critically. Thank you.
Honorable Chair, if you look at the manifesto, one of the things is try to promote traditional medicine. They have an association, a very large one they call GAFTRAM, and we meet with them quite frequently to try to encourage them to register their products with FDA. To register, there are two things that they need to find out from whatever concoction, whatever medicine you present to them. First of all, the Center for Plant Medicine Research will have to test for toxicity, such that you don't put in organisms or toxins that can cause other diseases to people who take your medicine. Then after that, FDA will certify for safety. And if you go through these two processes, then they give you a license to market your product with a shelf life that will give expiry and all that. So when they register you for this, the FDA has got a surveillance unit that goes around the markets to try to check registered products and non-registered products. If they find non-registered products, they will want to take them off shelf and probably even prosecute the corporate who is doing that. If they find that you are selling expired medication, not only traditional medicines, but even the ones imported from elsewhere, right? They will clamp down on you. And that is the way for FDA, and I believe that is happening. And therefore, we wouldn't discriminate against traditional medicine people and the orthodox medicine people. So far as you are doing expired, you are doing products that are not registered, they will clamp you on. We are encouraging them, we are educating them, we are facilitating them to get their friends to FDA and plant medicine research for these particular tests to be done and approved, certified.
Yes, all right. Yes, Honorable Member for Tamalinov.
Well, thank you very much, Mr. Chair. I wish to exercise my opportunity of a follow-up of two by starting with the use of one of those, Mr. Chairman, if you will oblige.
The use of what?
The use of one of the two follow-ups that I ministry, because he's a former Minister of Health at the time.